Congratulations again to Sinead and Richard. I love that they have a video from their CEO, Lutz Schuler, congratulating them on the work they've done, showing that their work matters to people who matter. Incidentally, they are only the third talk to have achieved this, joining American Airlines and eBay. And by the way, if any of you have a technology story that your CEO appreciates and is willing to talk about it, please tell me about it. I have a conference that I'd love for you to tell your story at. Okay, here is a story behind the next talk. In January, I saw someone post something on Twitter who mentioned how the flow metrics described in Dr. Mick Kirsten's book, Project to Product, explained how hugely valuable it was to minimize the separation between the, quote, technology and vaccination teams. So you can imagine that this caught my attention. So I reached out to Dr. Anne-Marie Cunningham to learn more about what she was referring to. And what I learned was absolutely amazing, because she and her team of 15 people were instrumental in helping get Wales to be one of the very fastest countries to get vaccinated, as well as having one of the highest percentage of the population being vaccinated. We all know how important this is for every society, providing a critical capability for the most dire medical emergency and dire economic crisis in 100 years. Regaining any degree of normalcy is simply impossible without it. I thought of how incredible it would be to share her story here at DevOps Enterprise, and I was so grateful that she said yes. So Dr. Cunningham is a medical doctor, a general practitioner, but she also has been an academic researcher. As Associate Medical Director for Primary Care for Digital Health and Care Wales, she helps build software, which includes the scheduling system that supports all child vaccination, which, it turns out, can be a huge part of the puzzle when you're trying to vaccinate an entire population. So here to tell her amazing story of how this helped nearly get every citizen of Wales vaccinated is Dr. Cunningham.
Hello. I'm here today to talk to you about supporting the delivery of COVID vaccine in Wales through the development of the Welsh Immunisation system. I grew up here in the Mournes in Northern Ireland and studied medicine in Belfast and trained as a GP. You might know that as a family medicine doctor. I then moved to Cardiff in Wales via Bristol because I was considering retraining as a public health doctor. I changed my mind, but I am glad that I completed my Masters in Public Health because I've always enjoyed working in health at a systems level, as well as working with individual patients. For 20 years, I have worked as a GP in this village in the South Wales Valleys, Gelliger, and alongside that, I have held various other roles. For 13 years, I worked in the medical school as a researcher and an educator. I was lead for the use of technology in the undergraduate curriculum. And then in one of our statutory health boards as a primary care clinical director. It was named after Aaron Bevan, the founder of the NHS, before I joined Digital Health and Care Wales as the primary care clinical lead 5 years ago. In this post, I would call myself a clinical product owner for several products that we work on. And by that, I mean that I work with our users, our stakeholders, and our development team alongside the product owners. But before this, I cut my teeth on digital health by attending and then running NHS Hack Days. These are 2-day hackathons which bring together technologists, designers, clinicians, patients, and the public. And these coincided with the start of the government digital service 10 years ago. It was a time whenever expectations were really being raised off public sector IT and digital delivery. And that applied in the health sector as well. So one of our strap lines for NHS Hack Day is Geeks Who Love the NHS, but the other is making NHS IT less bad. So given that, when I took my role in Digital Health and Care Wales, one of my friends said I had moved from being a maverick to mainstream, but there's still some of the maverick in there. So now I'm going to take you back to the summer of 2020. Springtime had been very hard. Everyone was exhausted with the changes that COVID had brought, particularly those working in health and care. I had been leading our primary care response in the organisation, doing what we could to support staff who were changing the way that they worked at an exponential rate, and supporting data initiatives such as our Shielded Patient programme, where we used clinical data about the population to try and identify those who were most likely to be vulnerable, so that they could get added support. But unfortunately, thousands of people across the UK and in Wales had died from COVID, including the most vulnerable living in care homes and the elderly. But by the end of June in Wales, we had 4 days where there were no COVID deaths. We had survived the first wave of COVID, but we did expect a second wave to come. We just didn't know when. Still, there was a sense of measured optimism about. The UK government was starting to purchase millions of doses of vaccines, which were yet to be approved for use, but there was a belief that sooner or later they would be available. And the Welsh government had asked the 7 health boards in Wales, who have a statutory obligation to plan for their population's health, to start getting ready for the biggest vaccination programme we were ever going to see against COVID. So what we did know was that COVID was a devastating illness, and that vaccinations were going to be one of the ways that we were going to be able to stop people dying and getting very ill. But there were many things that we did not know. When was the first vaccine going to be available? Which vaccine would be approved first? How many doses of it would be needed? How long would the interval be between doses? Could vaccines be mixed?